Hello, I'm Dr. Denise Furness, and I'm a geneticist who specialises in nutrigenomics and epigenetics. I began my training back in 2003 under Professor Michael Fennick, who is the world leader in nutrigenomics. I went on to do my postdoctoral fellowship focused on preconception and fertility, so obstetrics gynecology, and we had huge success, particularly in our recurrent miscarriage clinic, utilising DNA testing alongside other functional markers, diet, nutrition, and these sort of personalised interventions for our couples. But then in 2012, I moved from a predominantly research role into full-time clinical practice, working with a range of patients utilising DNA testing to help them get to root causes of their health concerns and really, truly help them get well. So my focus now is really on healthy aging. So I myself have had an autoimmune diagnosis, which I've recovered from, and my mum sadly developed mental health issues, which resulted in dementia. So I do have the genes that put me at risk for Alzheimer's and dementia. So what I intend to share with you when I'm in Dubai is these key genes that increase risk for depression, anxiety, Alzheimer's and dementia. And not just those genes such as BDNF or COMT that I'll explain that directly influence the brain, but also looking at other pathways that influence inflammation. We know this is a trigger, and some people are more genetically susceptible to having chronic inflammation. Some of us, depending on the genes we inherit, will be more sensitive to chemicals and toxins in our environment. And this can be a trigger for mood and mental health disorders. So understanding people's susceptibilities based on their DNA can be really powerful. But when we're using this in clinic, the DNA itself is not enough. Yes, it helps us understand what could be going on in that individual, where the areas we want to focus on, their genetic risks and sensitivities and susceptibilities. But if you think about the saying, the genes load the gun and the environment pulls the trigger, it's this combination, this interaction between our DNA and our environment that really results in this phenotype, or what we're expressing if we go on to manifest disease or disorder within the body. And really that's what nutrigenomics is. It's the study of looking at our DNA and the interaction with our environment, particularly, key nutrients. So we know that we can optimize gene function, modify our DNA with our environment and our diet and changing our lifestyle. But to measure this, we need to use some kind of complementary testing. So alongside DNA testing, the power is in really having other markers such as organic acids testing or Dutch testing that has some oat markers, in some cases even a stool analysis, because this helps us understand what's going on in the patient right now, understanding these environmental influences, how that's affecting the body. But you can then use these complementary tests down the track with your patient to monitor and track their progress. So it's really using the DNA testing along with this complementary testing to understand and get to these root causes and help your patients truly get well, but also set them up for lifelong health. And on that note, last year I ran the BioAge study where we showed that you can actually reverse biological age using diet and lifestyle without any crazy interventions. And I'll be sharing that with you. So in this study, we showed that we could improve mental well-being, mental fitness and resilience, and reduce the risk of age-related conditions, including Alzheimer's and dementia. So here in Australia, I lecture for ACNM. So this is the college, the main college in Australia that teaches medical doctors and health practitioners about integrative medicine. So doctors and specialists who are doing their fellowship in integrative medicine learn about nutrigenomics and epigenetics from me, and I teach them the power of DNA testing along with these functional medicine tests to really get better outcomes for their patient. And as I said, it's not about the short term. This is about long-term health. And I can't wait to share all of this with you in Dubai.